I had some friends, Kelly and Elise, who recently asked me about all the different treatments for the neck. And I don't know why they're asking for those treatments, because they don't need that. They need a lot of other things, but not that. Just kidding. But if you have any questions about other treatments that you're interested in or things you want me to talk about, please just direct messages. I'll be happy to talk about. But anyway, treatments for the neck. We're going to go from the least invasive to the most invasive, depending on what's wrong with the issues you have with your neck. If you're worried about like wrinkles or crepey skin, or maybe you have bands right here, or turkey gobbler neck. Those are all different concerns people might have with their neck. But as far as the things that can be done with the least invasive treatments, if you have some bands here, that can be associated with neck muscles, or maybe even some lines across the neck. That could even be associated with neck muscles that are a little overactive. So you can do Botox to the neck, Botox or Xeomin for those bands to the neck, or even those lines across the neck. Then if it's due to some crepiness or wrinkles and things like that, then one of the things people were asking about is, can you do laser resurfacing? And one of the risks about laser resurfacing is that when you do laser resurfacing anywhere, it knocks out a lot of the cells that create pigment to not make you look too hypopigmented, or like people who have vitiligo and kind of areas of where they've lost pigment. You have fewer cells that create pigment in the neck. So if you do laser resurfacing in the neck, then because you've knocked out more of those cells, you can have more issues with hypopigmentation, or more whitening of the skin in the neck. When you do laser resurfacing in the face, you knock out those cells, but you have more of those cells, so you don't really notice the whitening of the skin or the hypopigmentation as much. So that's a big risk of doing laser resurfacing to the neck, is that it can lead to more hypopigmentation. So that's why you want to be a little bit more reluctant to do that, or hesitant to do that. Other issues with the neck, if you have some jowls, there are other non-invasive treatments that use high energy ultrasonic waves to tighten up the skin, tightens up the collagen. That can help improve the jowls. Things like Ultherapy, you can use that along the jawline. One of the things I've heard about that is it's pretty painful, so even though it's non-surgical, you still have to get a Valium or something to tolerate the pain associated with that. And then going to even more invasive, if you have some misplaced skin in the midline, then you can try the semi-neck lift that I developed, the single incision minimally invasive neck lift. Whereas a typical neck lift, you have these big long incisions behind the ears, and then also an incision right here. The incision right here helps you go in, do liposuction, tighten up the neck muscles, because there's this hammock of neck of muscle called the platysma. You can go through this incision here, you can tighten up that muscle, and you can do liposuction along the jawline, and that's the semi-neck lift, and we're able to reposition the skin along the neck, really redrape it. That way we can avoid those incisions behind the ears, because the incisions behind the ears are for the purpose of removing excess skin. And then you do have to make those incisions if you have like a really big turkey gobbler neck, a lot of excess skin. Then we make the incision here, tighten up the neck muscles, do liposuction, but then we'll have to make those incisions behind the ears to remove the excess skin. So that's the big difference between a full neck lift and a semi-neck lift. Is the semi-neck lift, we don't have to make these incisions, because instead of cutting out the skin from back here, we can just reposition it, redrape it across the neck, and that way you can avoid those long incisions, which in women you can hide those incisions, but they're still painful. In men, it's really hard to hide those long incisions behind the ears because of short cropped hair. So that's why whenever I have the opportunity of somebody that needs a neck lift, if I can get away with doing a semi-neck lift and provide them good 10 to 15 year results, then I'll definitely do that and avoid those incisions behind the ear with a full neck lift. But anything less than that, I would definitely try Botox for the lines across the neck, or the muscle bands, and Ultherapy can, like I said, also help with some jowling along the jawline. But I would definitely stay away from laser resurfacing of the neck, because that can really lead to hypopigmentation. Hope that was helpful. Please let us know if you have any other questions. Just DM us. We'll be happy to answer them.